have a packed schedule, so I'll go ahead and introduce Josh Warfield and let him introduce himself a little bit. And he is going to be doing an overview of the adult outpatient mental health system in Chester County. Thank you, Josh.
Sure. Thanks, Christine. Good morning, everyone. Happy Saturday morning. Thank you so much for joining us here today. I wanted to just, again, thank NAMI, thank Sarah and Christine for having me, allowing me to be here to talk about county-funded mental health services that we offer here in Chester County. Look forward to sharing a lot about the different types of services that are available that you may be aware of already, or maybe you're not aware of, but wanted to share this information with everyone so that, yeah, hopefully when we're done with the overview, you'll have a better idea of what types of services are available out here in Chester County. So I'm going to go through a PowerPoint presentation for everybody that's going to talk about a lot of this. And feel free, you can head to the next slide. Thank you. So for everyone who's looking, this is our mission statement. This is what we do. Our role as the Chester County Mental Health Intellectual Developmental Disabilities Office, for the mental health side of that office, our goal is to publicly fund mental health services that support recovery. And you can see, I won't read the whole mission statement as you see it there, but essentially that's what it is. We want to help promote recovery for individuals who are dealing with any sort of mental health crisis potentially, or just a mental health diagnosis that they are, first discovering as they're going through their recovery journey. As things are happening and they are looking for help and support, that's what we want to do. We want to be able to help fund that for folks who maybe don't have any kind of insurance, either because they're not working or potentially not able to work. We don't want any kind of barriers for people to be able to access needed mental health services. So here's our mission statement. You see that is the website on there, www.chesco.org. That is a general mailbox. So there are questions, things like that can always be sent there. And the number at the bottom, that is our main office number. If you call there anytime during the week, usually from 8:30 to 5, our office is open Monday through Friday. We have a delegate who works in the mental health office who is available to answer questions. You can call up and talk to somebody at any time during the week. Next slide, please. So who can access these funded services? So for adult mental health services, you do have to be a resident here in Chester County. For adult services, you need to be 18 or older. We do offer children's services as well, but that's a different topic. Children's and adult services tend to be a little different, but for this particular adult services, must be 18 or over in order to get that. You have to be uninsured or eligible for medical assistance coverage. So for instance, if someone may be uninsured because they're self-employed, maybe they don't have insurance that way, or it could just be that someone is not working. They're not able to work, or they're out of a job, so they don't have any coverage that way, but they might be eligible for medical assistance coverage. So anybody who doesn't have insurance can access these services if needed. However, if somebody is uninsured, what will happen is a financial liability will be done at one of our core provider networks. Core providers, we're going to talk about them in a minute, but what they will do is they will work with an individual to determine, okay, if there is income that's coming in, okay, what a liability would determine how much the individual may be responsible to pay for those services, if they don't qualify for insurance. Next slide, please. So here are our adult core providers that we contract with here in Chester County to provide mental health services. For an intake, or if you're interested in setting up services with any of these providers, what you would do is you could just call the main number, which is listed here. The 4 adult providers we have Human Services Incorporated. They actually have their main office is located in Thorndale, but they also have satellite offices in Brandywine and in Oxford. Elwyn's Adult Behavioral Health Services, they are located down in Phoenixville. And Creative Health Services, their main office is located in Pottstown, It's right across the border from Chester County, but we still fund services for folks, so people can go there if they live closer to that area. They also have a smaller satellite office in Spring City. And Holcomb Behavioral Health, they have a main office is located in Exton, but they also have a satellite in Kennett Square. So there are providers and different offices located throughout Chester County. As you know, Chester County is a pretty large county in terms of size. So we try to spread out so that people have more options available as to where they can go for services. All of the core providers that we contract with operate in a very similar way, and most of them offer pretty much the same services, depending on where you go, with maybe a couple of exceptions for different things. But for core services, all of them will provide that. Next slide. So how to access these services? Again, if someone has no insurance, you can just make an appointment at any of our core provider locations. You can contact them, call them up, and let them know that you're interested in scheduling an intake assessment. When you're there for that, they will do a liability determination, as I said, to determine based on your income. There's a formula, it's a state formula that is used to determine if a person has a liability, which they would be required to pay per month for any services. However, that is what is done in the beginning, and then as the person potentially could be applying for medical assistance or is waiting for medical assistance, if they are approved for it, then that would cover all their services. The liability will only come into play if someone does not qualify for medical assistance. And so we put that out there. If someone doesn't have medical assistance, there's also potentially a way to apply for a clinical abatement, which the provider would work with the individual on to potentially lower that monthly liability that would be owed. So there's definitely, we don't want that to be a barrier for anyone that's looking for mental health services, but we do have it out there, so we like to let people know. If someone does have medical assistance, you could go to any provider who accepts medical assistance and is also in network with the managed care organization. Anyone in Chester County who is qualified for medical assistance and has insurance through the Department of Public Welfare, Community Care Behavioral Health manages all of the behavioral health services through that insurance, regardless of which plan, physical plan of individual might have chosen. All of it is covered by Community Care Behavioral Health. So the nice thing is, if someone is uninsured and goes to one of our core providers to get started with services, while they're applying for medical assistance, once they're approved, Community Care also contracts with all of those providers. So somebody that's uninsured wouldn't necessarily go to a provider, then get approved for insurance and have to switch and go somewhere else. The Community Care also works with all of our core providers. That way, you can start services, you don't have to wait, and you don't have to switch to someone else because your insurance changed. If someone has commercial insurance, what I will do is I will tell people if they call, like, hey, where can I go? To contact the commercial insurance directly to see who's in network, because some of our core providers potentially may be able to take certain types of commercial insurance, but the networks and in the individual insurance plans are so varied and so different. It's hard to know until you actually go to that insurance company to find out who is in network and who you could potentially see. So if you do have commercial insurance, always recommend contacting them directly just to make sure that you're going somewhere, because there's nothing worse than going somewhere and starting and filling out paperwork and then finding out that the insurance doesn't cover it. So we definitely want to avoid that for people as much as we can. Next slide, please. So here are some of the general services that are available at any of our core provider locations. Outpatient services, which is therapy. It could be individual therapy. That's the most common, the one-on-one therapy. However, there could potentially be different types of group therapy or family therapy if that's something that is needed or people are looking for, that could potentially be there. But generally, the most common, as I said, is that one-on-one therapy with person and the therapist. They do also offer psychiatric evaluations. So there are psychiatrists that work at all of our core providers. They'll do the initial evaluation. And if it's determined that medication is needed or recommended, then generally there's a follow-up with the doctor. It may be a little more in the beginning, but then generally it kind of falls into a once a month pattern where you come in to see the psychiatrist who, make sure that the medication is working correctly, make adjustments as needed, write new prescriptions, things like that. But that is that general basic individual therapy and psychiatric appointments are at all of the core providers as far as services go. Next slide. Here are some of the different services that are available. One is blended case management, and I know there is going to be a whole presentation on blended case management, so I won't go too deeply into that right now. But basically, blended case management, those are folks who work with individuals with a serious and persistent mental illness, and basically help link them to other services, mental health and beyond. We also have certified peer specialists. Those are folks who have lived experience and have gone through training and become certified peer specialists. And what they do is they work with other individuals that are going through their own recovery journey and try to help share, what they've learned, and work with folks to help them as they're going through their own journey. And so certified peer specialists, it's a great program. It has, over the years, I've seen it really expand. I've been working in the mental health field here in Chester County. Well, let's just say it's been a while. It's been a few years. And over the years, I've seen the roles of peer specialists grow immensely, which is fantastic. It really is helpful. Being able to, I've seen people who, when, they're able to talk to somebody who maybe has been through something very similar to what they're going through, and how much that can help. It's a great program that's out there. We also have ACT, or Assertive Community Treatment. That is a very specific type of service that actually is our most intensive community service. So ACT is designed for folks who maybe haven't been successful in other levels of support in the community. It's a team of a team of different types of staff, comprised of a psychiatrist, a case manager, a peer specialist, a nurse is in there. There's a housing specialist, a DNA specialist. There's a bunch of people that kind of wrap themselves around an individual to help provide support and stability to have the person be able to stay successful in the community. So again, that's one that we do offer, but it's more when other types of treatment haven't been successful. Mobile outpatient services, that, like it sounds, that is one for folks who maybe aren't able to come into the office in order to see a psychiatrist or therapist, for services. So mobile outpatient is where the provider goes to them. So the therapist might see the person out in the community at their home, and be able to provide services there. And then psychiatric rehabilitation services, those are services that are provided either on site at some of our provider locations, or there can also be mobile psychiatric rehabilitation services. And those are services that help teach, it's not necessarily therapy or clinical types of services, but it's stuff that teaches about daily living skills potentially. Could be, hey, we're going to work on, showing you the best way to manage your checkbook, or to, prepare meals or laundry, and pretty much any kind of things that would assisting with daily living types of skills for folks to help them out as needed. So those are some extra ones. Next slide, please. Here are some other ones. And again, these are some of our housing. And again, there's some, I know there's presentations later today about this, so I won't go too deeply into this particular slide, but we do have residential supports. So CRRs, or community residential rehabilitation, those are mental health housing programs that are run by mental health providers. We have ones that we consider maximum care, where there is staff that is on site 24/7 to be there for support. We also have ones that are considered moderate, where staff maybe is on site during the day, but not at night, although they can be reached. And then we have our supported independent living programs, which again, going to be talked about later, but those are more independent. Staff may not be on site all the time. Maybe more they come by, they check in on the person and work with them. But those there isn't staff there 24 hours a day. And then there's mental health housing coordination. So for our office, we have a mental health housing coordinator who I believe is going to be presenting later today. But what he does is there's a committee that meets, there's applications in order to access any of these programs. There's an application that gets sent into our office and a committee that meets to review the applications, determine which particular level of housing support the person may qualify for, if any, and then they try to match people up with openings when they're available. So it's a brief snapshot, and again, there's more later, of our residential support programs. We also have employment support programs. Those are some of the providers that offer those. Again, employment support could be something as far as like a job coach to help somebody, like, hey, you're getting a job in a competitive type of environment, and a job coach can help with that. Clubhouse services in particular, that's one where it could be people learn job skills, but it's not in a competitive environment. So it's a way for somebody to learn, maybe different things, whether it's running a newsletter. It could be, a thrift shop, like stuff that goes into selling clothes, like marking them, with a price tag, running the register. It could be preparing food, like making lunches, selling what's being prepared to other consumers who are at the clubhouse that day. There's a lot of different things that they do, but it's mostly employment centered, where people can learn these skills, where it's not a competitive environment where, there's a boss hovering over them to make sure that they're doing everything that the boss wants them to right then. It's a much less stressful way to learn some of those skills. Next slide, please. We also, here in Chester County, we have crisis services that are available. Right now we have Valley Creek Crisis runs our crisis intervention program. It's 24 hours a day, 7 days a week. You can reach them either by their main phone number, which is the 610-280-3270, or there's a toll-free number that's there. And there's also 988, which you may have seen or heard commercials for. I've seen, actually have heard more about commercials coming out about 988, which is great. That is a national program designed to make access to mental health services and in a crisis situation a little easier to remember. Valley Creek has been a 988 provider since July 2019. So we've been lucky here in Chester County when they switched to 988. We were already a member, so our crisis services were able to just take that switch and run. So 988, if you call it, right now it is based on your area code. So if you call from a local number here in Chester County, it's going to ring to Valley Creek Crisis in Chester County. So just putting that out there. The Crisis Residential Program, that is a program that Holcomb Behavioral Health runs. It is located at their Exton location. It is a 10-bed unit and it's voluntary. It's designed for folks who maybe as they're coming out of an inpatient setting, aren't quite ready to return home. Maybe they need a little more time just with extra support. At that program, there's psychiatrists, there's nurses, they do groups, there's all kinds of things that they do. The person stays there. So while they're there, and the average length of stay could be anywhere from a week to 2 weeks. So again, it's a voluntary program, so it's not a locked unit like an inpatient setting would be. But it could be for somebody, like I said, coming out of a hospital, or it could be for somebody who's in the community that doesn't, need that support of a locked inpatient unit, but being at home, they need more support than just they're getting from that. So Crisis Residential, to access that, it goes through Valley Creek. So that's there. The Warm Line, I definitely recommend that. That is run by certified peer specialists that we talked about earlier. That is not a 24-hour service, but it's a service where I believe it's pretty much 8 to 8 every day, or depending, maybe 8 to 10, 8 in the morning till 10 at night. But it's run by certified peer specialists. People can call and just talk to somebody. It's very, it doesn't have to be anything in particular. It could just be somebody's going through a difficult time, wants somebody to talk to. They can contact the Warm Line and go from there. And then we also have on here the National Crisis Text Line. A lot of people, as they become more familiar and comfortable with texting, that number is always available that people can text and talk to somebody that way. So next slide, please. A couple more community supports that are out there. There's the CompPeer program. That is a voluntary program where people are matched up. Volunteers from the community get matched up with somebody who is going through their mental health recovery journey. And really, it's just for companionship. One of the things that people noticed was that, sometimes somebody going through mental illness and if they're struggling, they tend to be isolated. Some of that could be from, the illness and not wanting to talk to some other people, or it could be that people aren't sure how to interact, so they kind of step away. And CompPeer is just a way for people to kind of connect, just as hey, let's get together for a cup of coffee, let's go out, let's talk. It's a great program. It's been around for years. Yeah, I recommend it if folks are just looking for somebody just to be paired up with as for going out and doing some things, or if people wanted to volunteer to do it. Highly recommend it. There's also here in Chester County, we have the Suicide Prevention Task Force. That is a wonderful program. Exactly what it says. I know they're always looking for volunteers and people. If you're interested, the website is there. Feel free, please reach out. We also offer different types of trainings. We have mental health first aid trainings, which is kind of like a CPR or general first aid class for mental health. Mental health, those trainings generally are about a full day. They're about 8 hours, but they've been split up over the years. They've kind of changed a little how they're run, but fantastic training for anybody who just wants to learn more about the basics of some of the most common mental health diagnoses that are out there. There's also Question, Persuade, Refer, QPR trainings, which is, again, that one is a specific suicide prevention training. And those are about 2 hours to 2.5 hours. And it's just a great way to kind of make people feel comfortable with asking people if they're doing okay, how to ask somebody if you're worried. So both of those you can find on our website when they offer those trainings. So yeah, I recommend them if you haven't been through them. Next slide, please. These are just a couple more specialized programs. These are for folks who maybe got involved with the criminal justice system. There's mental health court, which is something that people who have been charged with a crime can be referred to if they're found that they meet the clinical requirements for the program, and legally the district attorney's office is in agreement with it. Then the person enters mental health court, and by going through the treatment that is being recommended and following through with the court recommendations at the end, if they graduate, then their crime the record gets expunged. So that is a good program. A lot of people have been through that. Mental health protocol, that's for people who maybe are coming out of having served some time, but their probation officers are trained, sort of the dot point right below that, probation officers who are specialized in mental health and can help refer people and make sure that they're following through with treatment. And then we do also, through our housing programs, we do have a forensic residential program for men who are being discharged from jail and are homeless. But that's accessed through the same process that you would for any of our mental health programs. Next slide. Okay, so here, this is it. As I said in the beginning, we do have a delegate who's available Monday through Friday at that number. Or this is my email address on there. Please feel free anytime if you have a question or anything that you are looking for more information on, please don't hesitate. Send me an email. More than happy to respond. If I know the answer, can definitely give it to you. If not, I can try to reach out and see if I can find it somewhere. So it's a lot of information and a lot of stuff. So please, if you need anything, if you have any questions, don't hesitate. Either reach out to me or, again, call our office anytime. So thank you very much, everyone.
Thank you, Josh. So one quick note, that was an awesome presentation, and I'm going to be going into the more specifics of blended case management. At the beginning, we said for each session, you're going to need an individual link, but you actually only need one link for the entire workshop. So if you've already logged on, no problem. You're just going to stay on the link for the rest of the time that you're here. All right, so let's get into it. Blended case management. You can go to the next slide. All right, so blended case management, it starts when you are referred to a blended case management agency. Josh mentioned this a little bit. There are some core providers that Chester County contracts with. And for blended case management, those are specifically Elwyn, Holcomb, and Human Services, Inc. And once you are referred to a blended case manager, you will meet regularly with them and you will make treatment goals dependent on your needs. So as I did interviews for this project, what people really stressed to me about all these services is that this entire system is guided by the individual and all of the plans are going to be really specific to what the individual needs. So even if it's treatment plan focused, the high needs are prioritized. So maybe you really need to get connected with a therapist, you really need help with med management. It's really going to just depend on what you need. Next slide. All right, so what's offered through blended case management? Again, it really depends on what you're looking for as the individual applying, but they can help with finding housing, applying for food stamps, budgeting and paying bills. You can get help with finding outpatient services like therapy, finding doctors or PCPs. And if you're on the Community Care Behavioral Health Plan, which is the Medicaid plan for behavioral health in Chester County, you even have access to things like a wellness nurse who does some nutrition, exercise work, and wellness connections. Obviously, not everyone will be able to access this, but your blended case manager can help you get connected with things like that. They can also help with medication management. And again, as I talk to all of the blended case managers or people who are involved with this system, the staff is really a highway to get people to where they want to be. And it is a collaboration between the individual and the blended case manager for this particular system. Next slide. All right, so who qualifies? Number one, this is really important. You must be a resident in Chester County. Each county has a specific community outpatient service system. So all of the things I'm going to say are only specific to Chester County. You also have to have something called a serious and persistent mental illness diagnosis. This is really a clinical term for the purposes of qualifying. And essentially what it means is your mental health symptoms are having severe impairment on your life. So maybe you're finding it difficult to maintain steady employment, to take care of yourself in certain ways, things that are really making it hard to have quality of life. And the persistent piece is also key, that it's been happening for at least a year, and these symptoms have been at a pretty consistent level. So that is a diagnosis you'll get from a mental health clinician or provider. You also have to be 18 plus. As Josh noted, all of these systems are different for the pediatric world. All of this only pertains to adult community-based outpatient services. It's also a completely voluntary program. And the referral can come from an individual, from the county, from hospitals or ERs, from family members. But I will say the most common referrals are usually from therapists, psychiatrists, providers of some kind. While it's possible to self-refer, it is somewhat difficult because there's a lot of documentation involved. All right, next slide. All right, where do you meet with your blended case manager? There is a lot of flexibility with this. Some agencies offer mobile services, which means that they can come to your house or come somewhere in the community if it's going to be difficult for you to make it to the office. There's also hybrid approaches with Microsoft Teams and in person, really whatever is going to be convenient for the individual. They can also meet at a public place like a local library or a Wawa, or they can meet exclusively virtually through Teams. The blended case manager really tries to work with what's comfortable for the individual, where they'd like to meet, what's going to be helpful with their schedule. Next slide. All right, zooming in just for an understanding of how often you're being assessed, how much support you're able to get. So the level of support the individual needs is assessed every 6 months through a matrix assessment. It sounds like, from my understanding, that you're probably going to meet weekly at most with your blended case manager. And this is really in the cases where there's a lot of high needs and there's a lot of things that the individual needs to be connected with. The treatment plan is updated every 9 days, and the average length of services really depends on the individual, but the average is 1 to 3 years of working with blended case management. And usually your appointments are about an hour. So in a case where someone needs a lot of support from their blended case manager, they'll probably be meeting weekly for about an hour. Next slide. All right, how to apply. As I said, it starts with a referral. So you will call the county or service directly to request a referral form, and I will have those contacts at the end of this presentation. You'll also need a psychological evaluation within the last 12 months. That can come from a psychiatrist. Maybe if you're coming from an inpatient program, you'll already have one on file, just any licensed mental health practitioner. And you will need residency in Chester County. We touched on insurance a little bit. You can use community care behavioral health, which is the Medicaid plan for Chester County. And if you're uninsured, you will collaborate with the county to figure out the payment. If you have commercial insurance for this particular service, you are considered uninsured because commercial insurance will not cover this service. Next slide. All right, and wrapping up, here are the contacts for all of the core providers for blended case management. I will also have a one-pager that we will be sending out within the week with all of these contacts. So as we said, this will be recorded, but if all of these contacts are a lot to write down, we'll have a page for you where you can look that up.